live. We're at the Konnect Africa is here at AfricaCom, and there's just so much going on. We're really excited because we found mobile schools health, and we're really excited about things that are sort of making an impact, that are really driving development in a way that's impactful. So come with me, we're going to see if we can find the team behind Mobile Schools Health and talk to them a little bit about this. So just walk with me and check out what the bus looks like. It's really awesome. And they've got this sort of cool video. So we're going to see if we can go inside the bus. It's a bit of a queue, as most buses do have. So I'm inside now. Wow, it's actually quite a surreal experience. And I found my first victim. Hi, Grant. How are you? Shanice. So we're with the Konnect Africa team, and we're just doing a Facebook Live to sort of find out what the innovations are. Because every time we come to AfricaCom, there's some really cool innovations. We're doing some really amazing stuff, and it's driving some really positive change. This is really interesting for us. Like, how does this work? Like, is it a mobile? Can you explain to us what's going on here?
So the program is built around preventative healthcare for children and really giving children who can't access basic healthcare a chance. So we use these retrofitted mobiles and we customize the solution to be a 3-in-1. So it delivers optometry services, primary healthcare services, so like vaccinations, deworming, things like that. And then at the end we have a dentist section where it's really around preventative like dental care. So we apply fissure sealants to the back of the teeth so that it prevents the tooth decay.
And do you find that a lot of the sort of preventative or interventions that you provide are things that can really be sorted out so easily, and it's just lack of access?
Yeah, so just to give you an example on eye care, they say that children suffer 80% of their learning actually occurs through their vision. And then if you take the stat, 1 in 3 children have poor vision.
So then they're not learning anything?
Yes, so they can't even read.
Oh, shit.
And then they're told that they're stupid or that they can't learn. So something as basic as us giving them glasses on site gives them a chance to get an education.
That's amazing. And how do you feel digital connectivity plays into this? What does it allow you to do?
So every mobile is connected by like 3G and in really hard to reach areas we actually have satellites.
Right.
And then we've actually built custom software on the mobile that allows us to capture the medical records as well. So those medical records are put in the bus and then we sync it out to like a central server. So connectivity has really allowed us sort of to be more mobile.
Right.
We even have software that helps to manage the buses, software that also helps with transparency. So the funders who fund the mobiles can even see how their project's doing. So we give them a bit of a connection to the project.
It's amazing because that must be really crucial, especially for funders, to just make sure their funds are getting spent in the right way. Do you have any trends that you see with this data? Like when you gather it, do you see which areas are perhaps struggling more or need this area needs to be serviced more? Like, what do you do with all that data? It's very fascinating.
It's a little bit difficult at the moment. We only focused in the Western Cape.
Okay.
But like what we have seen is like dental care is actually at its worst in the Western Cape.
Wow.
So we've even looked to maybe retrofit the buses with just dental care, so we can really target that problem.
Yeah, that's fascinating. Well, I just have so many questions,
No.
but so little time.
Yes.
But this is really amazing. Like, what we want to do as well is just reach as many people with some of these innovations, because sometimes you come to events like this and it's just the same text, sort of people meeting each other all the time. So it's nice to have an opportunity to sort of put it out there in the public domain, the public sphere. To anyone who might be watching this, is there any, I don't know, how can people help? How can we get involved? Because I'm thinking this is a great thing. It would be great to do it more than just in the Western Cape.
So initiatives like this are pretty much funded by government, so we become this extension to the healthcare system. But we also work with corporates, so CSI spend is very good for us, and then we can run initiatives that corporates want to focus on. And something we're looking at now is to try sort of a crowdfunding model. Let the people actually have a chance to fund it. So we're going to run a program in the 1st of December with the HIV campaign. and we're going to let people have the chance to fund a mobile to run for a month, so that it can get funding and deliver like HIV testing.
It's actually very genius, because I think the beauty of crowdfunding, crowdsourcing, is that you get data immediately from people that know areas that are impacted or could use your services. So would that be something you're considering as well? Because I know that there tends to be a lot of rural-urban migration, maybe outside of Africa as well, more than just in South Africa, I mean the rest of Africa. So you find a lot of people know back in their home villages this could be something that would really help. And they have access to data and connectivity, so they're able to say, can you come and do this in my village? And if you find that there's a lot of people asking for it in a particular area, would that be something that you're kind of interested in terms of how people can get involved? So people might be dropping like messages on this and like, this is so cool, how do I get in touch with Grant to come in? And maybe they can also motivate their governments or their areas. So your openness to taking it outside of South Africa.
And I think that's the challenge, is really how do you connect the need with the funder. So you only can get funding if there's really a need for a service. So I think people really obviously need to ask government, like if they're in, like say, the school's health system, like I need more of these mobiles. When it comes to CSI, I don't know, I'm still trying to work out that business model. How do you let the people request the bus to come to them? It's something we've thought of where it would really be nice if you could go online and you say, hey, I want this bus to be here, and then if there's enough interest in funding, then you make it happen. So,
I think we're getting there. Like I can really see the connection between what you're doing and how it's actually going to improve economies. Because without health, well, we have nothing, right?
Yes.
That's where it all starts. Learning, education is so important. Like what you said about seeing and learning is also so crucial. Gee whiz, you're like the modern day Superman. So I'm going to say thank you so much for allowing us into your space, and just it's been so nice chatting with you.
Okay, just something else. So our group, the group company, we actually provide like 3 other solutions. So we do like administrative services, we do like mobile classrooms, and then we also do what I mentioned, the health.
So there's more than just the health.
Like circumcision, maternity health. So this bus really, we have the capacity, because we build them ourselves as well.
Okay.
We can retrofit them to whatever you want inside. So it's about working with corporates, whoever, and saying, how can we help you? What solution do you want to give to the people? And we can help you get it to them.
So it's like a customizable, I suppose,
build your own.
That's pretty cool. And if I may, I just remembered a question. In terms of like the doctors and how does that work?
So we staff them.
Okay.
In this instance with the Western Cape provide the staffing. But in some other solutions we've worked, we actually will hire the staff, we will manage them, we provide them with their living out allowances. So it's all built into the project cost, so we can run the full turnkey solution.
That's amazing. Okay, I'm going to say thanks again.
Perfect.
It was so awesome, Grant. Thank you so much.
Great.
I hope you enjoyed the Facebook Live and that you learned as much as I did. It's such an amazing initiative. This is how digital really brings change to communities, and how we as a continent are actually going to harness just the youth, the potential, the drive to succeed in this continent. So keep it here, because Konnect Africa and I are going to bring you much more stories. If you can see over there, I don't know if you can see through, there's the A Hub happening over there, and that's like a lot of cool people gathered to sort of talk about innovation and driving change forward. For now, that'll be it, and we'll catch you on the next Facebook.